Hi class, let's continue our discussion on skin disease and focus on the poxes, aka the pustular rash diseases. Our two big ones are chickenpox and smallpox. Chickenpox is very common still, and it's mostly benign. It's not a life-threatening condition. Smallpox has been eliminated in the wild, and even a single case of smallpox is a public health emergency. Both of these are present as pox diseases that will present themselves as generalized rashes. These poxes are essentially small lesions or little blisters that contain a little bit of fluid that will burst and then crust over. Chickenpox manifests itself on the face and on the torso of the body, just like smallpox does. Smallpox also manifests itself on the face and the torso and appendages of the bodies. It's worth mentioning that the poxes in smallpox are larger and are oftentimes filled with pus, and will form, each pustule will form a scar afterwards. For chickenpox, the signs and symptoms will include fever and abundant rash. This is going to occur after an incubation period that can be as short as 10 days or as long as 20 days. The rash begins at the scalp and face and will radiate towards the extremities. The lesions that also are associated with chickenpox will progress quickly. They'll form macules and papules, and then will turn to itchy vessels filled with a clear fluid. They will encrust after bursting and drop off after several days. They heal completely or may occasionally leave a small scar. Generally speaking, heavy scarring from chickenpox is not a common phenomenon. These lesions can number from just a few to the multiple hundreds. Most of the times, they're going to be more abundant in adolescents and adults that come down with chickenpox. Young children that come down with chickenpox, generally speaking, aren't going to have as many lesions. The signs and symptoms of chickenpox also include the lesions being distributed centripetally. In other words, there's more lesions along the central axis of the body, or in the center of the body, than the extremities. These lesions will last from 4 to 7 days. New lesions can stop appearing after as little as 5 days. And the lesions can crust over and dissolve themselves or go away by themselves in as quickly as 3 days. Approximately 1/10 of 1% of cases of chickenpox are followed by encephalopathy, or swelling of the brain. This is oftentimes fatal. Recovery is complete in most cases, thankfully. Closely related to chickenpox is shingles, or herpes zoster. The virus that causes this disease will enter the sensory endings of the dermatomes after recovery from a chickenpox infection. The dermatome is a section of skin that is all innervated by one thoracic nerve, and there are 4 horizontal bands of skin that travel down the body. The signs and symptoms of shingles include asymmetrical distribution of the infection across the skin of the trunk or the head, so it'll preferentially be distributed on one side of the body. It, generally speaking, is going to develop very quickly after some stressful stimuli. It can be a physiological or a psychological stress, an X-ray treatment, or surgery. Something that would normally be very stressful for the body can trigger the release of the shingles virus. As the virus is migrating through the body, it will move through the nerve ganglion and then towards the skin. As this virus is migrating through the nerve ganglion, multiplication of the virus will resume, and it's going to produce a crop or a multitude of tender lesions that are persistent on the surface of the skin. And they will also cause inflammation at the end of the nerve ganglia. This is known as post-herpetic neuralgia. And as this inflammation occurs, there's extreme pain associated and tenderness that can last from days to months. Sometimes a cranial nerve can be involved as well. And if the cranial nerve gets involved, it's a much more serious condition, because those are the nerves that control some of the vital life functions and the movements of the face and primary sensory organs. If the cranial nerves that, depending on which cranial nerves are involved, the eye can be inflamed, and we can have ocular and or facial paralysis. Here on the right, we can see the dermatomes, which each correspond to a cranial nerve, a thoracic nerve. And then here we can see a patient exhibiting the crop of soft, tender lesions. That's characteristic of shingles because it's traveling in a horizontal stripe down the body that's parallel to a dermatome. Both chickenpox and shingles are caused by the same thing, human herpes virus 3, HHV3. Human herpes virus 3 is going to enter via the respiratory tract and attach to our respiratory mucosa and then invade our bloodstream. The viremia that is going to disseminate the virus into our skin. As that virus is disseminated into our skin, adjacent cells will fuse together through our syncytia and then lyse, causing our characteristic lesions. Our virus then enters the sensory nerves and the dorsal root ganglia. While the virus is in the sensory nerves, it can remain latent for many months to years until that stressful event can cause it to emerge again and exit latency. Humans are the only natural host for human herpes virus 3, thankfully. It's typically harbored only in our respiratory tracts, and depending on how we are exposed to it, we can either get it from a respiratory droplet or from an active lesion. Sometimes individuals can acquire this disease because they're exposed to the fluid from a shingles lesion as well. Anybody who's infected is going to be infectious for a day or two prior to the development of the rash. The chickenpox virus, or human herpes virus 3, is so contagious that if you're exposed to it, there's a near certain chance that you'll develop the disease. So to prevent getting chickenpox and shingles, we have the live attenuated vaccine, which was licensed in 2006. This prevents both chickenpox and shingles. If somebody had chickenpox when they were younger and they don't want to develop shingles later on in life, they can take the Zostavax vaccine, which was also approved in 2006 to prevent the development of shingles. Treatment for both of those diseases is uncomplicated. This uncomplicated form of the disease, or varicella, is very self-limiting and will typically run a course and require very little therapy aside from some alleviation of the discomfort. Occasionally there'll be secondary bacterial infections. These secondary bacterial infections typically can get into the body through the lesions on the skin, and it will require either topical or systemic antibiotics. Oral aciclovir or antiviral medications should be administered for individuals that are at risk for complications of this disease, or if someone is actively experiencing shingles. Our next pox disease is smallpox. Thankfully, smallpox has been eliminated from the wild. There was a comprehensive global effort by the World Health Organization to vaccinate the human population to eliminate smallpox from the world. After the outbreak of anthrax bioterrorism in the United States in 2001, we began taking the threat of smallpox bioterrorism much more seriously. And the reason we have done that is because most people in the United States and in the developed world are currently not vaccinated against smallpox. And just because smallpox has been eliminated from the world doesn't mean it doesn't exist anymore. There are several labs where smallpox is known to exist, and occasionally smallpox can turn up in research labs as well. As recently as 2014, when some technicians were cleaning out a storage room, they found 6 vials of freeze-dried smallpox virus. Smallpox has signs and symptoms that can be similar but more profound than chickenpox. There'll be fever, general malaise, and a rash that begins in the pharynx and mouth and will spread to the face. This rash is both macular, papular, vesicular, and pustular. It's a nasty rash. It will crust over, and it's going to leave non-pigmented sites on the patient that are pitted with scar tissue. Unlike chickenpox, which rarely causes scarring, smallpox almost always causes scarring wherever one of the papules bursts. Variola major is the form of this virus or form of this disease, and it's highly virulent. It can cause toxemia, shock, and intravascular coagulation. So it can cause a patient's blood to clot in their blood vessels. It's very important to recognize the signs and symptoms of smallpox. A single case of this must be treated as a public health emergency. The prodromal phase is going to have high fever and malaise. The rash will emerge from the mouth, and there'll be severe abdominal and back pain in the patient. As the disease progresses on the patient, the rash will spread throughout the body within as little as 24 hours. After the third or fourth day of contracting the rash, bumps become larger and will become filled with a thick, opaque fluid that contains high amounts of pus. These pustules will become indented and begin to scab over within a few days. Within 2 weeks, most of the lesions will have crusted over, but if the patient remains contagious until the very last lesion and scab is removed from their bodies. During the rash period, the patient will be very ill. Lesions are going to heal on the dermal level, so they'll heal at that living layer of the skin, but leave scars in the process. Variola minor is the less virulent version of this infection. If somebody's infected with variola minor or contracts variola minor, they'll have a rash that's less dense than the variola major rash. The patient will also not be as sick compared to a patient that has variola major. Both variola minor and major are caused by the variola virus. It's an orthopox virus that's enveloped in DNA, that contains a genetic information in DNA and is enveloped. This virus is also in the same group that includes monkeypox and vaccinia. It's a very tough, durable virus. It's very hardy. It's capable of living outside of their host longer than most other viruses. To transmit smallpox, it's spread primarily through droplets, sometimes a fomite like a contaminated bedding or clothing or other object that the patient came in contact with can spread the disease. It was endemic in 31 countries as recently as the 1970s. And at that time, as recently as the 1970s, 10 to 15 million people contracted the disease every year, and 2 million people died from it every year. The massive vaccination effort lasted 11 years and eventually eradicated the disease, with the last confirmed case in the wild in 1977. There is no treatment for smallpox. Our best bet is prevention. So if you see a patient with many small papules forming over their bodies, you're probably going to be dealing with someone who has chickenpox. And if you see them with much larger pustules forming over their body, you are probably going to be dealing with smallpox. So, concept check class. Before a patient can develop a case of shingles, why do they need to come down with a case of chickenpox? Why does someone who was vaccinated, or they need to come down with a case of chickenpox? Why does someone who was vaccinated for chickenpox almost never develop shingles? Is it A, the HH3 vaccine is equally effective against both forms of the infection? B, the vaccine prevents HH3 from entering the patient's nuclear genome? C, the vaccine induces antibiotic production via the patient's gut bacteria? Or D, all of the above? You can go ahead and rewind the video, flip back in your notes, or check your textbook for the answer. Go ahead and pause it and get me the answer. 1, 2, 3, 4, 5. All right, class, the correct answer is B. The vaccine prevents the HH3 from HHV3 from entering the patient's nuclear genome. If a patient is vaccinated for chickenpox and never develops the chickenpox disease, then the virus is not capable of infecting their cells and going into latent period within their cells, and then the patient will never be able to develop shingles later on in life. If you are an individual that was exposed to the chickenpox virus, whether unintentionally or intentionally when you were younger, and you develop chickenpox, if you do not receive the Zostavax vaccine, you stand a chance of developing shingles later on in your lifetime. If you have any questions for me about this material, please feel free to post them in the class discussion boards or shoot me an email. Happy studies.